Hello, my name is Dr. Brett Gilbert. I'm here to discuss with you a topic of the essentials of endodontic diagnosis. We want to develop skills that will combine patient information, clinical testing, and radiographic interpretation in order to determine the proper endodontic diagnosis. Endodontic diagnosis. Prior to initiating the diagnostic process for endodontic cases, a realistic risk assessment is really necessary. When you think of endodontics, risk does come to mind. Very easy to get off on the wrong foot, to get off into the wrong direction, and wind up in a situation where you're uncomfortable, and therefore it could lead to more of a procedural accident or incident. And very important to really be able to assess what the case is prior to beginning. Once endodontic treatment is initiated, you have to be prepared to handle these adverse incidents. Having a plan in place for what to say and do, as well as how to react and proceed when tackling an adverse incident, will really help alleviate a situation in which the patient could lose confidence in the treating clinician's abilities. So never, never, never start treatment without a definitive diagnosis. That might lead you to feel as though this type of pain may be in a different realm. Okay, so we're at a key point here in the lecture, and after completing this portion of the lecture, the learner should be familiar with the following. First of all, the importance of risk assessment prior to starting any endodontic procedure, the process of communication that's necessary to learn the history and present symptoms of your patient, and the importance of an appropriate radiograph in the process of endodontic diagnosis. If you just simply are unclear about any of these points, please go back and review the previous slides. In our video, you can see that we just palpate always along the buccal wall. The lingual wall is also going to be useful. However, some patients may have exostoses or other sensitive areas under very thin alveolar mucosa. So I tend to be a little more reserved on palpating the lingual side. Back to key points. After completing this portion of the lecture, the learner should be familiar with the following. The set of clinical tests used to develop a definitive endodontic diagnosis, the importance of the clinician's interpretation of the test, and the importance of putting all pieces of the diagnostic puzzle together to arrive at the definitive diagnosis. If you are unclear on these points, please go back and review the previous slides. Nomenclature. So when we look at making a proper diagnosis for endodontics, you really have to compose a pulpal and a periapical diagnosis. And really, the proper documentation of your pulpal and periapical diagnostic terminology as set forth by the American Board of Endodontics will provide you the proper medical legal charting that you really need to be able to legally justify the treatment you've provided to your patients. I thank you for your participation in this course. I certainly hope that it's something that may be helpful to you clinically at the chair side. And again, just encourage you to really think through the whole procedure and recognizing that the first step is the most important step.